Hi, this is Dr. Juno Bolding. I want to talk to you a little bit about the vagal nerve reset, and that's what I like to call this, a vagal nerve reset therapy, sound therapy. But first, I want to address why the vagus nerve is important and how I can help you with that and why it can be so impactful. All right, so this is just a picture of the vagus nerve. It's the 10th cranial nerve. It's the longest, and you can see ear, right? So there's a lot of therapies that we're looking at around the ear, and we'll see too that there's some therapies that come right down here towards the brain stem with electromagnetic resonance. They're using it for epilepsy and other issues, also including depression, etc. It goes into the lungs, the heart, the spleen, into look, it goes into the liver, the stomach, the pancreas, and the intestines. But there's more to it than that. So we're just going to go over to this study, and I like using studies because I like things that are peer reviewed, that have had an editor-in-chief, a scientist look over them. It's not foolproof, but it does tell you that it has been reviewed. And then you want to look at, what are you looking at? Are you looking at a case study or animal studies? The two studies I'm going to be sharing with you have multiple studies included in them. There's some that have some animal, but a lot of them are people, and then just some information as well. So, but let's just take a quick look. This is published in Brain Behavior and Immunity because there are potentials for behavior changes with the vagal nerve. When you're in fight or flight, you have an aggravated vagal nerve system, and then you can go into the calm, rest, and digest by treating the vagal nerve. And that can be done through sounds, and specifically the 40 hertz. I will say the treatments that I offer, I have treatment, believe it or not, between 0 to 10,000 hertz. And there's ways that are very sophisticated ways of getting in there and figure out which ones to use. But we can always still put in and use the vagal tone, along with other sounds that are curated just for you at the moment you need it. And you can listen to them at home. So you can do your treatments at home easily on your own and at the very moment you need it, which ties in beautifully to neuroplasticity. But let's look at this. Body-brain communication is essential for regulating the immune system, and it's the key mediator between the body and brain communication. When I worked with Acupuncture Without Borders, um, you would see how profound this was, because ear acupuncture, there's also research on that we're not going into today, but also affects the vagal nerve and resets it in a way that people who are in this fight or flight dysregulated state and trauma can't think straight. They're looping, they are scared, and they can't sleep, they have pain, and just one a treatment sometimes, and then especially if they got more treatments, would help them turn into that switch, that dimmer switch. What happens for some people with when their vagus nerve is dysregulated, it's like a switch that they just can't quite get to switch back around. These sounds help do that, just like with the acupuncture. Also, the gut-brain axis is mediated by the vagus nerve and is implicated in neuropsychiatric disorders. So there's a lot of, so transcutaneous auricular vagal nerve stimulation holds potential as a therapeutic intervention. So auricular is the ear. So that's where some of that acupuncture comes in, but sound, right? I mean, let's look at this picture again. Sound. And the research I'll be going into in a minute on Alzheimer's in relationship to the 40 hertz, they did both sound and light stimulation to try to try to help reset the vagal nerve. Um, and let's see, you can look into a lot of this. There's just so much here. Basically, look at inflammation-related disorders. There's stuff about Parkinson's, Alzheimer's, cognitive, behavioral, across the board. There's also implications in other studies that we won't go into right now, but about um, like people with autism, this type of thing, or other neuro atypical profiles that may just be more sensitive to light, to sound, and need more help regulating. This goes into some of the different pathways, which, if you're interested, I mean, I find all this lovely. Look at all this beautiful stuff to look at. And this was just looking at, this is when the second century was when the proposal of the vagus nerve by Gallian. And then it wasn't until the FDA in 1997 approved VNS, so for epilepsy, for the vagal nerve stimulation here. This is when some of the anti-inflammatory pathways related to the vagal nerve into 2000 to 2002 were established. And then transdermal. So there's basically, you can go into all these different areas of kind of the history of the vagal nerve, and people have been using it. It has been FDA approved for different reasons. Um, and you can go into the history if you like. All right. I'm going to pop over to here now and just look at this study, the evidence that 40 hertz gamma stimulation promotes the brain. And this is expanding a lot. This is just March 2025. This is from MIT News. But if you look at this, last year, the lab reported in Nature that 40 hertz audio and the visual stimulation induced interneurons to mice to increase the peptide VIP, promoting clearance of amyloid from brain tissue via the brain's lymphatic plumbing system. This is really important, and this is into cognitive therapeutics. This is just more of what the research is and what they're heading towards. They're looking at it even as interventions for things like chemotherapy side effects and conditions like that reduce myelin, such as multiple sclerosis. So I just find that all interesting. And I think it's really important to take a look at. And I'm really happy that I have something that I can offer to people. And all right, so this is the one of the last things here that I'll talk about, and then I'll do another video on more about how I'm offering and what I do. It's a little complicated in science, very simple in practice. So simple and so powerful. So I'm really proud and happy to be able to offer an ability for you to take sound with you in a very specific, curated way. But if you look at here, so there's so much here with neurodegenerative disorders, visual, auditory. You can just kind of go on. Improved learning and memory performance. Limited human trials suggest that it's safe and well tolerated with people with mild cognitive impairment and early stages of Alzheimer's. But that's also with people who have stress, anxiety. So it's what we're talking about, like um, mm, just it really many people can use it, and some people are more vulnerable, and something like this that can be simple can be really helpful. Um, and it talks about still looking at things like lifestyle modifications are important to decrease inflammation through the system, which also, with my years of experience as an East Asian medicine doctor, and just 30 years of dealing in health, I have ways that I can help you look at that as well. Um, all right. Well, if you want to take a look at this study, um, you can, but basically, I was saying earlier, like people were listening to it. Again, I have frequencies, everything from 0 to 10,000 hertz. And then these ones have a little bit of like a modulation in here. Um, Reduce of neurotoxic protein deposits, synaptic function, and neural work synchronization. It's nice to feel like your whole body and brain are working for you and not against you. Attenuation of oxidative stress and modulation of neuroinflammation responses. Yeah. Enhancement of metabolism and regulation of cerebrovascular function. So your metabolism, your digestion, and also your brain and your vascular system. This one was in mice. So anything that's in mice or just a study by itself is not as predictive. This still could use a lot more research, of course. So cognitive and daily function improvement. And these were in people. They were not large scale, but what we want to do is look at all, like this is just one area of 40 hertz on aging cognition. And you can see already there's quite a bit of information. Neural function and pathogenical biomarkers positively influenced with 16 patients, 50 patients here, and that showed statistical improvement related compared to sham, which meaning like, they did a fake, they wasn't really 40 hertz. So, all right. You can just see there's a lot here. So I'm hoping you get the idea. You can take a look at these studies. If you just want to pause and screenshot, you can and look them up yourself. There's a lot of studies out there as well. And here's some great ideas for in the future how they want to use 40 hertz stimulation for targeting Alzheimer's. But I am taking this and putting it on a more broad level based on what the Alzheimer's done and what I've actually seen in my practice. I've seen really amazing results. And so next I'll talk about what it'd be like having a session and how some of that would go, as well as what some of the technologies look like.